When you need auto parts, O'ReillyAuto.com is just a few clicks away. We offer convenient options for you to get your parts quickly. Order online and pick up for free at your local O'Reilly Auto Parts store. We'll even bring it out curbside. Or you can have your parts delivered right to your door with free shipping on most orders over $35. Visit O'ReillyAuto.com.
O'Reilly Auto Parts.
Girls, we want to meet you wherever you are. Welcome to the Dare to Ask podcast, episode 5, Spine Spotlight.
If you have back or neck pain, we are happy to see you.
I'm Corey Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with the woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Corey Jensen and sponsored by Essentia Health.
My special guest for this episode is Crystal Knutson, a physician assistant specializing in neurosurgery at Essentia Health. And she is a magnet. You warm right up to her. You're drawn into her. Now, she specializes in brain and spine, and our conversation actually led a little bit more into spine health this time around. And of course, I asked her about her personal life. She's a wife, she's a mom, and she gave some great direction. The one thing you should not be doing for very long when it comes to your spine, and also... And there was a crazy tidbit about sun exposure and your bone health and what in the world they have to do with each other. We're going to cover a lot.
We're going to get them in the right direction and find somebody that can take care of them.
So let's get to it. You brought in a coffee. What's your coffee drink?
I brought in a nitro cold brew with a little bit of heavy cream and sugar-free vanilla.
Is that your go-to?
I actually never get coffee in the morning. I usually just drink Folgers at home with creamer, but it's a special day, so I thought I'll stop at Caribou, and then I had a little extra time. So
now you have girls.
I do.
What are their big interests right now for a 4- and 7-year-old?
So they watch shows together, and right now Henry Danger is what they are watching, which drives me crazy. Kendall, my oldest, who is 7, is in American Gold competitive gymnastics, so she's very busy. And Maggie was in gymnastics, but she was kind of naughty, so we pulled her. So she's just at Small Wonders, which is their daycare in town, and she loves it there. They do a lot of drawing. Kendall pretends to teach Maggie, so she teaches her how to write letters, and yeah, it's cute.
I love that, the whole school thing. So my 2 youngest are kind of in that same exact age range.
Yes.
Yet they love to watch shows, and they watch their shows together. They're both interested in basically the same things. What is it with kids? You can't tear them away from a television anyway.
No.
Even if it's a show they say they don't like, they'll sit there and watch it. You get done with that when you get older.
Yes.
Like,
no, you only have time to watch certain things.
Right.
Yes.
Yes. I only have so much I can dedicate to a screen. Kindergarten and 2nd grader is what I have.
Okay.
And the kindergartner got a Melissa and Doug school set from Santa.
Ooh.
And it had everything from the clocks to the pointer. You know what I'm talking about?
Oh, that's
There's a whole
great
bunch of things.
idea.
And we actually really love it. And a
Oh,
teacher bell. It's super cute.
I think I need to invest in this.
You do. Are you a shopper who likes to try things on, or are you good with online?
I need to shop in this. I mean, I like certain things. If I know my sizes, I'll shop online, but I love to go somewhere and pick out 200 things, and I usually leave with 3 because I just like to try on. That's like what I miss the most now that I'm a mother, actually, because I don't do that.
Yeah.
I used to go to TJ Maxx or Target and just try. And I cannot do that anymore.
When I would have a cart heaped full and they're like, you can only bring in 9. And
like,
I would take like 5 trips back.
Yeah. I'll come out with 4.
I'm more of a solo shopper in that regard.
Same. I would not shop with somebody else. I wouldn't expect them to be patient for me.
Because I want to feel relaxed enough to do it, right? I don't, come and show me.
Oh, I know. Either you like it or you don't. What does it matter if somebody else does?
Oh, absolutely. I'm like, these are not going to see the light of day on me.
In fact, I have brought people with and felt the whole time like, oh, I'm really taking a long time. And they're like done a long time ago.
Yep.
They pretend they don't care, but I know they do. Yeah.
And I try to bid my shopping with girl time in different ways. Try not for it to be closed. Or if I do, then it's kind of like ordering just a salad at dinner. It's like I'm pretending to be somebody I'm not. So I'll only take 3 things in the try on. When real me wants the steak.
Yes.
Like I want the cart full of
That's
clothes.
funny.
So Crystal Knutson, physician's assistant.
Yes.
And you and your expertise, the spine.
Spine.
I
have been neurosurgery for 13 years, but most recently I'm focusing more on spine, yes.
Well, you kind of wear a couple different hats.
Historically, I've been a PA in neurosurgery working in the clinic, the hospital, and the operating room as first assist. And recently, I want to say 2 years ago, we started a spine care program. Yeah. And the spine care program is intended to take care of anybody with neck or back pain that's acute or chronic, and they just need a place to go to start to get directed and to kind of follow the process of conservative treatment to get them better. Since we have opened the spine program, I have to wear 2 hats, like you said. Mm-hmm. Half of my clinic will be neurosurgery and half will be spine. So I have to, right before I walk in the door, look, okay, is this neurosurgery or spine? And then kind of approach it a little bit differently, because the neurosurgery patients are more surgical decision making, whereas spine patients are neck and back pain who need conservative treatment, some general basic education.
Does it keep it fresh for you, like different all the time?
Yes. I hate to ever be complacent and get bored. Neurosurgery is never boring, but when you do something for 13 years, it's fun to change it up a little, and this certainly does that.
You had told me that Maggie and Kendall, your 2 daughters, love to play school. Did little Crystal have a white jacket and a stethoscope when she was a little girl?
I don't think so. I remember wanting to be a dentist for a while. Yeah. My mother was a nurse.
Okay.
So there was a little bit of medical direction, you could say. But I don't remember ever really knowing that I was going to do this.
How did your background get you to where you are now?
Wow, that's a big question.
I know.
I graduated from Concordia College in Moorhead with my bachelor's, and I was pre-med and intended to go to medical school, but I was with my boyfriend at the time, who is now my husband. We've been together for 20 years, and when I learned about the PA profession and how I could have this expedited version of being a medical provider, it was very enticing to me. So I chose to be a PA. I went to PA school. I was rotating in didactic phase the first year, and my mother had an issue. She was a traveling nurse in Anchorage, Alaska at the time.
Oh, wow.
And when she was in Anchorage, she developed a bleed in her spinal cord at T5. And she ended up needing a major operation with both a vascular and general neurosurgeon. And I was flying back and forth between Billings, Montana, where I was going to PA school, in Anchorage, Alaska. She did very well, but obviously there was some neurologic deficit that had come from that. And unfortunately, she never was able to return to nursing, but she's doing very well now. And it is the reason that I have been so invested personally into neurosurgery. I came back to Fargo after Billings and applied for a plethora of jobs. Fortunately, I got all of them, but then I had to make a decision. And one was neurology, one was neurosurgery. And I think I was the most scared of the neurosurgery position, but I couldn't help but to think that there was a reason that I needed to do this, and I have never looked back.
What a fire. Literally gave me goosebumps. Such a close familial element that helped guide you down the path that you were meant to be. And then you just, when you feel at home, you know, when you figure it out, like it's, oh, this is really where I was meant to be.
Yeah.
Makes you think big picture, too. Like, who's watching out for you?
Absolutely.
What is happening next?
It's interesting how life unfolds.
So what does your husband do?
My husband, Brandon, is a production supervisor, I believe, at Cardinal IG. They make windows for Marvin Windows, the insulated glass units.
Huge operation over there. For you to then be able to come back to here and find a job that you love and want.
Yes.
All of your family, his and yours, still right here in the Red River Valley?
We were both raised in Hawley, Minnesota, which isn't far from here. And that's where we met. We were high school sweethearts. His family is still in the Holly Lake Park area. My family is in like Detroit Lakes, Frazee, some in the cities, but yeah, all pretty local. Actually, it was just my mom and I growing up. I don't have any siblings, and she has moved to Fargo and designated basically her whole life to being the best grandma ever.
Dedicated her life to being the best grandma ever.
Seriously.
Very fortunate.
Yeah.
What does holidays look like for you guys?
So we usually go every other year.
Yep.
And sometimes we do his family and my mom still comes along because my closest person is my mom. So I kind of get the best of it all because we get his family every year and then my mom both that year and every other year. So
absolutely.
Yeah.
What about traveling? Are you a traveler or are you more of a homebody?
You know, I used to travel a lot. Yeah. You know, my mom was a traveling nurse, so I was able to travel a little bit where she was located. And then after PA school and becoming a PA, I would travel for work and I would do a lot of CMEs in all areas of the country, including Germany, actually.
Oh, wow.
But since I have small children, it's a little limited.
The game changes.
Yes. I think, you know, one day I'll be there again. But right now, I've kind of become a little bit more of a homebody. Yeah. And we're happiest at home with just the four of us and our dog, Duncan. And that's our safe place.
Yay. The good side of a pandemic, if you will, is that benefit of more family time and that reprioritizing that we've all been forced to do. Let's talk a little spine talk. Lay some facts on me.
What kind of questions would you have about spine or neurosurgery that you have always wondered if they are a myth?
Sleep. And position. Prioritizing where your spine is when you're sleeping.
I mean, sleep is important in general. As far as your spine goes, spine likes a neutral position. Spine likes your knees bent. If you lay on your side, a pillow between your knees. If you lay flat on your back, you don't want too big of a pillow. It will flex too much. Too small of a pillow will extend. Yeah. So it's all about maintaining a straight, neutral spine, but also listening to your body, and everybody's different, and just doing what feels good.
I am a stomach sleeper, and I know how terrible it is for my back, and I'm assuming, and yet I cannot break myself from this habit.
I don't really think it's that big of a deal. If you sleep on your stomach and you're comfortable, if you don't have back problems, it is what it is.
So then let's say I do have back problems.
Oh, boy. Then I would say so do I, and I sleep on my back.
Yes.
You know?
So you have back issues as well?
I do.
Okay.
I do.
So do you feel like you know how to correct your issues?
Absolutely, yes. After I had my first child, I started running again, a little too quick, a little too hard, and without a strong core. And I did develop some back and leg pain, ended up doing therapy and didn't get the best relief. So I had an MRI, and I do have degenerative disc disease, and I did end up needing to get an epidural steroid injection, which was a tremendous help for me. And I've been great since, but I do feel flares here and there, and I know that certain activities will push me over the edge, and I have to daily do some sort of core exercise. Okay. And if something starts to hurt, I know to change positions and listen to my body. I do think that with people who have a pinched nerve, if there's any leg or arm involvement, you have to listen to that and change positions and do whatever it takes to make that go away. And if that doesn't...
let's let this go on for a couple days.
My general rule of thumb is if you start to hurt and it lingers for 7 days or more, that's when you need to start considering going into your primary care provider.
Gotcha.
The first thing is always anti-inflammatories, ice, heat, whatever works, position changes, postural restoration. And if all else fails, then that's when you go into your primary and maybe even the spine clinic.
Yeah, I might be calling you. You mentioned posture, and I feel like your office chair, which so many of us now, the reality is if you have got a desk job, you are spending so many hours a day sitting. What can we do? Do you buy your own chair? What would you suggest with all of that?
I would suggest, if you have the option, to meet with an ergodynamic specialist that will come in and evaluate your work settings so that they make sure everything is where it needs to be, but also to consider a sit-to-stand desk option. That is a cost that you usually have to get approval for. I write a lot of notes for sit-to-stand desks. It's really important to not sit too long, stand too long, or do anything in any one position for any length of time, because that's when pains start.
Yeah.
It's important. I think 20 minutes sitting, 20 minutes standing is a general good rule. Now, that's not always realistic, obviously, but I do think changing it up is the answer.
What about shoes? How big a role do shoes actually play in your spine health?
I pay hardly any attention to shoes because I feel that is better served in a podiatry setting, somebody who actually deals with like orthotics, prosthetics.
Yeah.
I think that everybody has a different spine, a different body, different arches. And because of that, we need to, rather than focus on the heel or the brand, but rather focus on what feels good. If you're wearing a shoe that's cute, but it feels good, I think that's likely just fine.
Right. That's part of where I think there's so many unanswered questions to the layman out there. Okay, it's not my feet hurt, it's my back, but then I hear you should stop wearing heels. And so then...
Yeah, that's true. I mean, it's hard to know what's what.
Yeah.
I think if your back is hurting and you're wearing heels a lot, one would consider then to wear a normal, flatter shoe. But not to say that would make a difference either. It's really trial and error.
So much of life is such a trial and error, isn't it? Like, what would you say that you just wish people would stop doing?
I wish people would understand the importance of physical therapy. There are so many people that come into the clinic and they have this negative, they just think therapy's not going to work, or I can do exercises on my own. And these therapists are specialized in spine, and in our spine program, we have a lot of very good physical therapists that, in my opinion, are the core of the program. And they're the people who get them better to avoid a lot of medical costs for the patient and interventions and surgical intervention. Knowing the importance and value of physical therapy and maintaining a strong core and general lean body weight are probably the most important things with spine care. And you just can't minimize any of them and expect your back to get better.
Yeah. Let's talk about that lean body weight, because of course, nobody wants to hear that they need to lose weight.
Right.
But what does the spine say? How much added extra weight, or outside of, let's say, you already know for my height, for my age, for my gender, here is what my healthy weight range is. How far can we deviate?
It all depends on body habitus. Everybody carries their body differently.
That is so true. Yeah.
If you gain weight throughout your body, you may not feel the brunt on your spine in a way that somebody who carries all of their weight in their abdomen. Generally speaking, abdominal adiposity is going to pull forward and hurt your back more than anything, but then also just general increased weight. If you're carrying an extra 25 pounds on your spine every day, obviously that will have some long-term ramifications. That being said, there are a lot of morbidly obese people who have no back pain at all. So it's, again, it's all dependent on each person. I myself find myself, I can't stray my weight more than 5 pounds before I feel it in my back because I have an underlying back problem.
Yes.
And so I have very little tolerance for weight gain because of my back, whereas somebody else may not have that same experience.
I mean, what speaks to me when you say that is just how in tune you really are with your body, how important being in tune with your body is. And now we're going to get into the women realm, because as a woman and as a mom, you know that we so often put everybody in front of ourselves.
Yeah.
And I will fully admit that, like, my in tune with my body has wavered over the years. And usually when I'm spending the most time really doing my self-care practices and thinking of myself, that's when I'm feeling the best too. Like, my overall body isn't in pain.
Absolutely.
But when I let go of that, and of course everything else starts to fall to pieces, but over here, my house is clean, my husband's happy, my kids are healthy, everything is good. But
It's a balance.
it is such a balance.
Particularly women are at increased risk for osteoporosis because of our loss of estrogen after menopause. I see so much of that in the spine clinic, whether it's a compression fracture or just general osteoporotic pain from the softening of the bones. And so it's really important that we stay strong. The more you stay at your normal weight rather than going under, the better your bone quality tends to be. The one thing that weight actually has an advantage is that it helps your bone quality. And so I would say that with women, it's very important to take calcium with vitamin D and to maintain good bone quality and ideal body weight.
The bone quality. The least sexy thing, right? That we even think about, but I just want to fit into the skinny jeans, or we're not supposed to wear skinny jeans anymore. That's totally out. I don't know if you know that or not. I have teenagers.
Shoot.
We're driven by usually, what is that outward appearance? Internal, though, that I think we so rarely let that be the lead.
It ends up rearing its head later on in life. And I just can't stress enough how important calcium and vitamin D, especially in this area. We have winter for what feels like the whole year. And subsequently, we're not outside as much. And when you're not outside, you don't get vitamin D. And I don't know if you know this, but you can't absorb calcium without vitamin D. So if you're not getting adequate vitamin D, you still can have an issue with bone quality. So
I did not know that. That was a fact bomb you gave me.
Yes, that's so important. And we see a lot of osteoporotic compression fractures in this area of the country.
Really? And where at specifically do you see those? Is there a general area on the spine, or is it?
Throughout. Yeah, throughout. In fact, through the 13 years in neurosurgery, I can't tell you how many locums or new surgeons come and tell me that they've seen more compression fractures here than anywhere else. I don't know the actual statistics or if it's even a real increase here, but it would make sense to me given the lack of outside vitamin D exposure.
Right, the lack of the
vitamin
sunshine,
D.
the vitamin D. Explain that compression fracture.
So when your bones are softer, anything like bending over, coughing, sneezing, or straining, lifting something. I had a little old lady open a window in her home. That little bit of movement can cause a wedge compression fracture of a bone. The bone is supposed to look square and it drops down to more rectangular or triangular because it's soft and the end plate fractures. And that hurts. And then they have to wear a brace for 3 months. If the bracing doesn't work or if it doesn't heal, sometimes they need to have a procedure where we put cement in that vertebral body. And all of that is preventable if you just maintain good bone quality. So it's so important to make sure that you get calcium and vitamin D. And if you don't, just take it over the counter.
If you already know you have some of this, if your bone quality isn't where it is, can we start something now?
So you should always start with calcium and vitamin D, but if you actually have a bone density scan proving that there's an issue, your primary care provider would then talk to you about other medication options. Okay. And I would absolutely encourage that.
There are other options.
There are a lot of other options, absolutely.
Yeah. I think that's what's kind of the scary thing. So many people go from, I'm in terrible pain, the only other thing is surgery.
No.
There's many other things in between.
There are a lot of other things. And that's a big focus in the spine program. So somebody will come in with back pain or neck pain. I will usually start them in physical therapy for 6 to 8 weeks, full course of therapy. If they do not get significantly better in that period of time, that's when we talk about imaging and we get MRI, CAT scan, x-rays, whichever is warranted depending on the situation. And if somebody has something like a disc herniation with a pinched nerve, they would be a candidate for an injection. And an injection can get you through without an operation. And I am a perfect example of that.
Success story.
Yeah. I mean, 5 years ago, I want to say I had an injection and I have not had to have another. I occasionally feel the discomfort, but I know what to do to get myself through that. And I think that anybody who enters the spine program would be able to have those tools then in the future to get through that episode without a major intervention.
Yeah.
And that's valuable, because surgery is certainly not the answer.
Yeah. What if it is? Then now we're at the place where we do need surgery.
Yeah.
Lead me down that road.
So if it's to the point where we've exhausted all conservative treatments, or if there's neurologic deficit, then we move forward with surgical options. And surgery also has a plethora of different intervention options, whether it's decompression where you unpinch the nerves, or fusion where you have to actually unpinch the nerves and put in hardware to stabilize. And then there are a lot of variations throughout all of that as well. But if that's the answer, then we move that direction, and I would get that patient in with the surgeon then to discuss their options.
So you mainly focus on those conservative treatments first.
Yes, absolutely.
And you've brought up neurological deficit now a handful of times. Will you give me some of those warning signs?
Sure,
that I might be able to pick up if I haven't even seen my doctor yet, but this would hopefully be the catalyst to pick up the phone and make an appointment.
Right. So neck and back pain are one thing, but if you start getting a radiating arm pain from the neck or radiating leg pain from the back that is associated with numbness, tingling, and even worse, weakness, that would be a reason to be seen for sure.
Okay.
Now, the neurologic deficit part comes in with a full neuro exam that I think I would bore you to even begin to divulge. But if you have those symptoms, you should be seen by somebody in spine or neurosurgery, or who is familiar with a very specific motor exam with reflexes that are also indicative of spinal cord injury. And that provider then would determine, is there neurologic deficit or not? If there is, images are warranted right away. If not, then we go down the conservative road. But to answer your question, it would be any radiating arm pain, leg pain, numbness, tingling, weakness.
That's good to know. Put that on my short list of warning signs. Shift gears a little bit. You're in touch with so many different elements.
Yes. We have one neurosurgeon, one orthopedic spine surgeon, myself, PA in neurosurgery, and a nurse practitioner in neurosurgery. This nurse practitioner and I run the spine clinic as the first person that they see when referred to our clinic. And then we triage them, guide them through conservative measures, and if it becomes a surgical problem, we turn it off then to one of the surgeons.
You would be one of the first people that say, if I had an issue, I would go and see.
Absolutely.
And then we would start some sort of course of action.
Yep.
Do you deal with a lot of referrals from primary providers?
Every provider has a different interest, and we get a lot of referrals from ERs, walk-in clinics, primary care providers, and each primary care provider has different interests. Some are more interested in OBGYN, some are more interested in neuro. So of course there's going to be, a little bit more coming from certain people that have a tendency to look for it more.
Yeah.
I would say there's no wrong referral to spine program. If you have back or neck pain, we are happy to see you. That's the beauty of it.
I like to hear that.
It may not be something that we can necessarily fix, and it may not be that it's all their neck or back, but it's a good place to start, and we're going to get them in the right direction and find somebody that can take care of them.
That's one of the things that I've said for many years now about Essentia, what I love. Do you see more accidents patients, or do you see more age and time patients? Do you know what that split would be for you?
I think it's 50-50, honestly. I think the younger crowd is usually some sort of injury or accident. They slipped on the ice. They reached over to pick a baby up out of a crib. They bent over to put their sock on. And then you also have a lot of the age-related degenerative disc disease, chronic back pain that we see. But I don't think it's more one than the other. I think generally the younger crowd is more acute injuries, whereas the older crowd is more of a degenerative chronic process.
We sometimes bring up Dr. Google. It doesn't really discriminate, it seems, in any kind of category. People like to self-diagnose before they pick up the phone and actually have a professional help them. What would you say to the person who tends to do that? And are you that person?
I am, actually. Yeah, I look everything up. I not necessarily Google, but I think there's no harm in trying to figure out what's going on. Of course, you can't perseverate on the details of every website that you see and think think that you have some sort of MS because you have a headache or,
Right.
there is a little bit of that. And so you have to be careful. But I don't discourage people from looking things up. And generally, it's a great resource.
I have found a little bit more the danger areas can definitely be on forums and within comments. Where you can get in deep, and then the next thing you know, a rabbit hole of a forum, you're in deep on comments, and you are certain that like the pinched nerve, I'm dying, or it's cancer.
Oh my goodness.
And it always ends up leading to one of those things.
Keep it simple. Don't look at what we call in medicine the zebras. Think of the horse when you hear hoofbeats. Unlikely that it's something real bad or detailed like that. It can be, but I would leave that up to the provider and not worry about doing that to yourself. Yeah.
There is always an exception to the rule out. Remember, in order to call it, you do need that diagnosis.
Yes.
And that means you have to have the intervention of a professional at some point.
Absolutely.
I really was driven by doing a podcast with these amazing providers at Essentia because my hope then is someone's going to hear some of the things that you said today. And that might be their, oh my gosh, this is a great piece of information I need to pass along to Susie because Susie was just complaining to me about XYZ and I think she could benefit from this.
Yeah, I think that's a beautiful thing of this podcast. I hope that the listeners are listening and thinking, because I know almost all of them know somebody or have some degree of neck or back pain. And my advice would be if you have neck pain, back pain, especially if it radiates into your arm or leg or is associated with any numbness, tingling, weakness, you should certainly be seen by a primary care provider and even consider being seen by a specialist.
You have given us tons of little wellness nuggets throughout this conversation that we've been having, which I've adored. Do you have any practices that you do for self-care or any wellness nugget that you would love to pass on to women?
Well, it does have for me a lot to do with the spine. Because of my back situation, after I had my second child, I have focused my daily routine on core strength, and I'm a member of Solid Core. I guess that's kind of my thing. Every day I do some form of group fitness, and I have a Peloton, and I think it's really important to maintain a strong core. And since I have done that, I have very little pain, and when I do get it, I know what to do to get myself through that. So I guess my wellness nugget would be to take an hour each day for yourself, strengthen your core, and maintain lean body weight.
Goals. That's all I got to say. Crystal Knutson, you are giving me all kinds of goals. Just having this conversation with you, I feel such a warmth. You are able to give some pain-free vibes out there. And I want to communicate that for those that are listening who aren't directly in the room with you right now.
Yeah.
So let your voice be a guide.
Oh, funny.
Thank you so much for your time. Humongous privilege and a treat to have you here.
Oh, thank you so much. It was wonderful.
PA Crystal Knutson in neurosurgery. I'm looking forward to having her back so we can get into more of the brain side of things. But next time on episode 6 of the Dare to Ask podcast, we're getting deep into the heart, into cardiology with Dr. Lola on the next Dare to Ask podcast.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.
Geico asks, how would you love a chance to save some money on insurance? Of course you would. And when it comes to great rates on insurance, Geico can help. Like with insurance for your car, truck, motorcycle, boat, and RV. Even help with homeowners or renters coverage. Plus, add an easy-to-use mobile app, available 24-hour roadside assistance and more, and Geico is an easy choice. Switch today and see all the ways you could save. It's easy. Simply go to geico.com or contact your local agent today. Your local agent today. Your local agent